Thank you, Madam Speaker. Colleagues, today we have the opportunity to take a very simple step to providing real cost savings to our public university systems. Yet, despite all the boasting we do about universities in this very body, and despite all the talk about doing everything we can to help education, today the House took a pass on those savings. House Bill 3508 is not complicated, and though I sponsored it, it wasn't my idea. It came from a report the university system itself published last year. The report, the Health and Welfare Plans report, noted that system-wide, the Oregon University system could save $67 million in the next biennium by using a health insurance program other than PEB. We tell our universities to prepare for massive increases in student enrollment due to population growth and the very legislative mandated 40-40-20 goals. And at the same time, we give them a pittance of their total funding and boost their reliance on donations, federal grants, student fees, and, of course, tuition. And then we box them into administrative cost drivers like the dramatically rising costs associated with PEB. The Oregon University system benefit costs have increased 132% since the 2001 school year. Some argue we can't let universities out of PEB because they're the healthiest among users, and if we let them out, health care costs go up for the rest of the state, and that might offset some of those savings. To that I say, so be it. I'm not willing to stand by and let students and parents eat unnecessary costs because the rest of state government is not as healthy or not as responsible in its use of health benefits. Is it the fault of the university or the university system that PEB's average monthly cost per member in 2009 was 32% above the national average for public employers? Look, we need to give our universities every tool they can to curb the rising costs associated with higher ed. House Bill 3508 would have done that. How do we tell students, parents, faculty with a straight face, we're doing everything we can, when a simple administrative cost-saving measure can't get consideration in this body? Thank you, Madam Speaker.